All new on Wink News, it's a modern-day case of David versus Goliath. A local woman is fighting for her quality of life and for cheaper drugs. Soon, she'll travel north
and share her story with the Food and Drug Administration. Wink News reporter Jessica Alpern tells us how this could help anybody struggling to survive.
Sharon Dill is fighting for access to a new and better drug. She has a disease called porphyria. Some days the pain is so bad she can't get out of bed. She says the only available treatment is extremely expensive and doesn't prevent attacks. Just 3 years ago, Sharon Dill was at the apex of her career, an executive at Florida Cancer Specialists in Fort Myers and an active person. That all changed.
It's a pain that if it doesn't stop, you just sometimes ask God to take you.
She's describing living with acute porphyria. The American Porphyria Foundation describes this as intermittent acute attacks of illness. There's only one available treatment, and it's costly.
The problem with panhematin is, one, it's extremely expensive. It can cost over $16,000 for one infusion, and you're talking about having it from anywhere from 3 to 14 days.
In a bad year, Dill says she's needed at least 50 infusions. The bigger issue, it only treats patients after an attack. A new drug could change that.
There is currently one drug in clinical trial to actually help prevent attacks. It would be just life-changing to people with porphyria.
Desiree Lyon-Howe is the executive director of the APF. She says in a few days, more than 30 patients, including Dill, will speak before the FDA.
The FDA approves all drugs, and unless they really understand what patients endure, they may not understand why a drug is needed.
The FDA tells Wink News patient input from the meeting could provide important patient context that can support FDA staff as they conduct benefit risk assessments for products under review, advise drug sponsors on their development programs, or identify opportunities for further discussion. Howe says it's important the FDA understands why the existing treatment can't be the only option. She also says it will raise awareness about diagnosing porphyria. The FDA would only be able to review applications for new drugs for safety and effectiveness. The cost of new drugs is set by manufacturers and distributors. Back to you.